My name is Maya Pridgeon, and I am a program manager for the Institute for Coordinated Community Response. A little bit about ICCR. We are a program funded by the Office of Violence Against Women, and we serve rural communities. And we have a cohort program that helps serve these rural communities, and we also have our monthly webinars. I'm going to share my screen. Our program is funded by OVW, and the thoughts and opinions do not reflect that of OVW. A part of our training is that we have national training programs, which such as monthly webinars. We also have on-demand learning, our Cacao Summit, as well as our resource library. Today, we're going to have LeTesha Davis Pyke with UGMA, and the subject is going to be strengthening and establishing domestic violence fatality review teams. And I'll turn it back over to LeTesha.
Hello, everyone. Welcome. Thank you so much for joining us today. I'm so excited to be here and talk more about domestic violence fatality review teams. And I just hope to shed some insight on domestic violence fatality review work and discuss this topic with you all. Start sharing. Okay. Can you see this okay? Awesome. Okay. So I do want to start with a disclaimer, our OVW disclaimer. This presentation was supported by this grant number awarded by OVW, the Office on Violence Against Women, U.S. Department of Justice. But the opinions, findings, conclusions, and recommendations expressed in this presentation does not necessarily reflect the views of the U.S. Department of Justice. So a little bit about UJIMA. So UJIMA is a national resource center that provides training and technical assistance basically to anyone who needs it. UJIMA was founded in 2015 by our Chief Executive Officer, Corman Cotman, and our Chief Legal Officer, Ms. Greta Gardner. And they created UJIMA because they wanted to see a world where Black girls and women are valued, respected, safe, and live free from violence. The name Ujima was derived from the Kawanza principle Ujima, which means collective work and responsibility. We stand by our name as we really believe it takes the community to come and help us to do this work. And our areas of focus are sexual violence, domestic violence, community violence, sex labor trafficking, and institutional and structural violence. So here are our pillars of programming. These are all the things that we offer and provide. We do outreach and capacity building. We go out into the communities. We do exhibition shows to hand out resources just to be within the community. We provide training and technical assistance, such as being here today. And we also have a research and evaluation working group. And they provide us with information that we need to provide technical assistance or any research that we need to support our work. We also work on policy and legislation. So we have worked on the Violence Against Women Act, the VAWA 2022 Act, the Family Violence Prevention and Services Act, and the VOCA Fix. We've also advocated for the Crown Act, which prohibits discrimination against a person based on their hair in the workplace. We also work on 5 areas of access, and these areas are critical for survivors in the Black community. And it's economic justice, legal access, health equity, housing, and international gender-based violence. So here are our objectives for our training today. So we're going to learn more about the domestic violence fatality review teams, ensuring culturally specific project. We're going to understand how DVFRTs can prevent future DV homicides, understand the importance of developing culturally specific responses in DVFRTs. Hopefully, you're going to recognize key challenges to developing and sustaining a DVFRT in rural communities. And we're going to develop strategies to enhance culturally responsiveness to sustain DVFRTs in rural communities as well. So this is a little bit about the project that I manage. So it's Domestic Violence Fatality Review Teams Ensuring Culturally Specific Responses Project, and it's a joint initiative by the Office on Violence Against Women and UJIMA. So we provide training and technical assistance to local, state, and tribal governments to establish or enhance DVFRTs and to ensure that these teams are culturally responsive and sensitive. We work to provide training and technical assistance on culturally responsive community engagement strategies and to better respond and to prevent domestic violence homicides for victims in marginalized communities. So these are some of the things we provide. We have office hours every third Thursday of the month, which I'll provide you with information towards the end of this webinar. We host webinars such as these on relevant topics that's related to domestic violence fatality review work. We had one recently reviewing suicide in the context with domestic violence, pregnancy and domestic violence homicide, just a variety of different topics. We also have information and resources on DVFRTs on our website as well. And some of the examples of resources you might find is that we created on behalf of this project, navigating family involvement in domestic violence fatality review, key elements of culturally responsive fatality review work, considerations to develop culturally responsive legislation, and a host of other materials are also available. So some of you are probably already aware of what a domestic violence fatality review is, but for those who do not, domestic violence fatality review is an important process that aims to understand and examine the systemic interventions that took place before a tragic event to prevent a similar incident from happening in the future. So fatality review helps to determine what went wrong and what could have been done differently to prevent this tragedy. Domestic violence fatality review is usually a multidisciplinary group of experts from different community systems who come together to review the circumstances surrounding a potentially preventable death. So some states have statewide teams, and then some states have county teams who also review these domestic violence deaths. These teams often have different names. So sometimes they're called domestic violence fatality review teams, death review teams. So several different names, but it's basically all the same thing. So domestic violence fatality review is usually a great tool that could help any community or state to better understand the patterns and trends and to improve coordination within their state and enhance prevention strategies and policy development so that we could avoid these homicides in the future. So here is a list of domestic violence fatality review teams here in the country. So we compiled this list based on research of teams in the US, and we reached out to teams individually to confirm some of the information that we found as well. So we're actually developing a national domestic violence fatality review team directory. And usually the teams are listed here. If it's listed here, we found information that stated that they were reviewing fatalities at some point. We did notice throughout this research that some teams start and did end abruptly sometimes, and we think it's due to funding issues, staffing, or sometimes even having buy-in from organizations. But here you could see if your state is currently reviewing domestic violence deaths and whether they're doing so on a county or statewide level. For states without a fatality review team, I recommend looking into what it takes to establish a team so that you could identify causes of deaths and implement changes based on the findings in that review. So overall, the purpose of a domestic violence fatality review is to identify barriers to safety for victims. You want to identify gaps in services, the nature and frequency of the fatalities, to learn from those circumstances and offer recommendations for improvement to create a safer environment for individuals who are at risk for domestic violence. So it's a myth that the focus of a domestic violence fatality review team is on the focus of job performance, but it's not on individual performance, but rather functioning and coordinating agencies and looking at the system as a whole. So reviewing system responses. Usually, when you're conducting fatality review, jurisdictions begin to see patterns of need and opportunities across systems to develop programs, policy recommendations to improve coordination and collaboration overall. Domestic violence fatality review fosters community awareness, and ultimately, it can reduce domestic violence homicides when we learn from the deaths that are currently happening. So, why is it important to implement culturally specific responses into domestic violence fatality review work? It is important because women of color face alarming high rates of domestic violence fatalities due to barriers seeking and maintaining their safety. I do want to clarify that just because women of color die at higher rates, it does not mean that men of color are inherently more violent. What it does say is that different cultural, racial, and ethnic groups may experience domestic violence differently, and they face unique barriers when they're trying to remain safe. So, culture actually shapes risk, help seeking, and survival. So, culture could influence how abuse is experienced and understood. Culture also influences whether a survivor trusts systems enough to even seek help. Unfortunately, due to historical and present day racism and oppression, victims of color do not trust systems. When they do, we are told that more than likely they are more than likely to be criminalized by the system when they seek help, and oftentimes they say that the systems hurt them more than help them. So survivors from marginalized communities often face greater scrutiny and less protection when they do interact with systems, unfortunately. So another issue is one size fits all reviews miss lethality indicators. So in standard domestic violence fatality review frameworks, they often prioritize physical violence, criminal justice involvement, and incident-based data. But one size fits all approach for domestic violence victims are not appropriate because experiences, their risks and barriers and pathways to safety are shaped by their culture, sometimes geography, which we're going to talk about later, their identity, resources that are available, and systemic factors as well. Survivors also experience abuse differently. Some survivors may experience community pressure to keep domestic violence silent. For example, sometimes Black survivors face backlash from their support systems when they do interact with systems because they're accused of putting another Black man in a system that already incarcerates them at higher rates. So you don't bring law enforcement to these communities that are already over policed. So there is a pressure to keep family matters private. And also this loyalty to their race and culture and family serves as another barrier to that keeps survivors from reaching out for services, which ultimately could be life-saving. Other victims may experience language barriers and fear of deportation, so they do not reach out to systems. And then LGBTQ plus survivors may fear discrimination from service providers as well, so they may not reach out to systems. And then you have survivors with disabilities who may depend on their abusers for care. So that's a barrier to reach out for systems as well. So barriers to help are not the same, and access to safety depends heavily on the context. So rural survivors face isolation, lack of transportation, limited shelters, and dual relationships with law enforcement as well. Some survivors rely more on their faith leaders and informal networks rather than courts and shelters. I know that this is true specifically for Black survivors. So, victims of color usually rely more on family, friends, our church, and our faith leaders for support and resources. And while this can be beneficial, it can also have a negative consequence since they are often not educated about domestic violence and lethality factors as well. So, another barrier is that even though there are domestic violence services available, oftentimes these services are not culturally responsive. So, when reaching out for help, survivors of color may experience working with service providers who do not look like them, who can't speak their language and can't share their experiences. And also, victims of color are more likely to experience financial constraints, lack of opportunities, and ability to earn a livable wage. They do not have resources to relocate most of the time, lack of affordable housing options. This is all a reality for most victims of color. So, financial dependence on the abuser makes it very difficult for survivors to leave abusive relationships as they fear of economic stability for their children and themselves. So, when culturally responsive DVFRTs recognize these barriers, we don't I'm sorry, I'm a little nervous. I'm trying to relax. But when culturally responsive DVFRTs actually recognize these barriers and ignore the context of culture for survivors, we allow systemic harm to remain visible in fatality review findings. But when we incorporate culturally specific responses, we could produce more accurate findings. We could generate realistic and community informed recommendations. It improved cross system accountability and strengthened prevention efforts beyond the criminal legal system as well. So here are some statistics for victims of color in regards to domestic violence homicide. So we're aware that domestic violence and domestic violence homicide does not discriminate, and it can happen to men and women of all races and ethnicities. But research has found that young racial ethnic minority women are disproportionately affected according to the CDC. And then also a new study was conducted and released last year analyzing data from the CDC between 1999 and 2020. And they found that Black women are 6 times more likely to be killed as a result of domestic violence than white women. And this stat used to be 3 times more likely. So it is currently 6 times. And every year, the Violence Policy Center releases a report with details of all reported homicides of women killed by men in the US. This report usually ranks states based on these findings. And last year, they completed an analysis of the previous 25 years, and they found that Black females have consistently been murdered by males at a higher rates compared to all other races in the last 25 years. We also have more than half American Indian and Alaskan Native women who experience physical violence by intimate partners in their lifetime. And American Indian and Alaskan Native women are nearly 4 times as likely than white women to be fatally shot by an intimate partner. Then we have 60% of Latino homicides in the US are a result of intimate partner violence and intimate partner homicide. And while American Indian and Pacific Islander women die by intimate partner firearm homicide at lower rates compared to other racial groups, they experience the highest portion of firearm homicides by intimate partners, with 58% of gun homicides of women being committed by an intimate partner. So here's the state rankings for DV homicides of survivors of color based on some research we conducted as a part of this project. So as a part of this project, we held listening sessions and reviews with survivors of domestic violence and also with community-based organizations. And these states had the highest homicide rates for survivors of color. So we actually invited individuals from these states for the listening sessions to drive our training and all the resources that we developed as a part of this project as well. So as I mentioned on the previous slide, I mentioned the Violence Policy Center. And when they reviewed the statistical information, I'm sorry. I'm trying to relax. This never happens. I don't know why I'm so nervous. Sorry, y'all. So, from the 25 report analysis report, the Violence Policy Center, again, it was from 1996 to 2020, and they released this report. And during this period, there were 8 states that ranked in the top 10 for more than half of the past 25 years. And those states were Alaska, Arkansas, Louisiana, Nevada, New Mexico, Oklahoma, and South Carolina and Tennessee. So, one thing that's worth noting is that virtually all of these states are southern or southwestern states, and the majority have higher rates of household firearm ownership. So, does any of this data surprise you? Feel free to chime in the chat. And Damaya, do I have any questions so far?
There's one question that asked about Black women who are, let's see, what does it say? Black women who are victims of DV homicides, are they being murdered by men of color too?
Yes. So sometimes, yes, it varies. So we know that Black women are dying at higher rates, but it doesn't necessarily mean that the offenders are Black, and also that Black men are inherently violent, as I stated before. And we talked about some of the barriers that survivors of color face, which contributes to the higher rates of domestic violence homicide. So not necessarily to answer that question that all the perpetrators are Black, but we do know that Black victims are dying at higher rates, regardless of who the perpetrator is. Any
That
other
was,
questions?
no, that was it.
Okay. So, past domestic violence fatality reviews have clearly identified several challenges linked to cultural aspects, which is the reason why we have this project and these trainings, of course. So, these reviews have shed light on several barriers and issues that survivors face when attempting to access services that are usually aimed at preventing and intervening in domestic violence situations. So, among these challenges, a lack of culturally relevant services is a significant obstacle that usually hinders survivors from seeking help. So, understanding and addressing these cultural aspects is crucial for effectively supporting victims and preventing future incidents of domestic violence homicide. Damaya?
Yes, there was a Melody Bassett who has her hand raised. I'm going to allow her to talk.
Okay,
Or
awesome.
Michelle Bassett. Yes, she doesn't have anything. All right, you can continue.
No, that's okay. And I believe the next slide is discussion as well. So chime in the comments, but also feel free to unmute yourselves and also to answer this question. So, what makes fatality review work harder and potentially more impactful in rural communities? So, chime in on the comments and again, unmute yourself. What makes fatality review work harder and potentially more impactful in rural communities? People know the parties involved, lack of resources. Anyone else? I see lack of resources a lot because everyone knows everyone, afraid to contact law enforcement. Okay. Yeah, and most of these, you guys are right on track. Privacy is very important in close-knit communities. So these are all things we're actually going to discuss in the second portion of this training. Yes. Oh, that's a big one. DVFRTs throughout the state aren't funded at all. Lots of conflict and interest between the parties in prosecution. Absolutely. Funding is a big issue. Lack of transportation. You guys are on it. Okay. Distrust of law enforcement. Absolutely. Okay, but first we're going to talk about starting the domestic violence fatality review team. So, starting the DVFRT is a process. This is a visual representation of the full cycle of creating and sustaining a DVFRT. And each box reflects time, trust, coordination, and relationship building as well. So, this slide alone can be an entire training session on how to successfully start a domestic violence fatality review team and sustain it. But today we're going to walk through some of these steps briefly, and I'm going to provide you with examples on how they should be implemented. So, a fatality review team typically includes representatives from the judiciary, prosecutor's office, law enforcement. You have DV advocates, medical examiners, public defenders, probation, corrections, and all others who are usually responsible for intervening in cases of domestic violence. Some additional members that is not listed here are attorneys, including both criminal defense, mental health providers, victim witness programs, if any are available, and forensic nurse examiners. So, one key thing that we always recommend that is not always recommended when you're thinking about building a fatality review team is that you want to have culturally specific community based organizations included on your team. And this ensures culturally responsiveness and it incorporates multiple perspectives within a review. Again, team members differ from across the country, but these are some ideal members to have on your team. A domestic violence fatality review panel, you may also invite other individuals to serve on an ad hoc basis as well, or participate as full members in a review for a particular case as well. So when you're selecting your team members, most teams are usually most effective when their membership includes representatives from all systems that are usually involved with victims and perpetrators of domestic violence fatalities. The team should include a diverse array of individuals from the community with respect to ethnicity, gender, and race as well. So I've actually had a team that was actually transparent and told me when we talked about some of the cultural responsiveness, and she admitted, well, everyone on my team is white. And my question was, does that reflect your community? What is the population of your community? And absolutely not. So those are things that you want to think about. It should be reflective of what your community represents. Your team should receive continuing training. So, not a one and done domestic violence and culturally responsiveness training. These trainings should be ongoing and current, um, of course, on all of this data, including culturally responsiveness. And one thing to keep in mind when you're selecting members, you want individuals who are able to commit to meeting times, usually folks who are non-defensive. So, because members must be open to examining gaps in system responses. That's the key to domestic violence fatality review. You also want someone with experience on the front line. So, the benefit is frontline professionals understand how policies actually operate in practice, and they can identify disconnects between written policy and lived reality as well. You also want individuals who are able to influence agency policy. So ideally, you want members who have some sort of authority or direct access to decision makers to implement recommendations found in your review. So, when building a domestic violence fatality review team, you want to start with relationships and not structure. So, before the bylaws and protocols, you have to build trust. So, before we opened a family justice center and high risk team in my community, it started simply with building relationships and working together on individual cases. So, meeting one on one with key partners, and you want to emphasize that this is about system improvement and not about fault finding because there's usually some hesitance there for folks to get involved because they're afraid of fault finding. But again, you want to emphasize it's more about system improvements instead. You want to invite trusted local champions. So start with individuals you already have a relationship with. You want to get solid confidentiality frameworks early on, and this reduces fear right away for members. So you want to use an MOU that clearly states the purpose, which is preventing and systems improvement. You want to have a MOU that outlines that information shared is confidential and protected. And sometimes it's based on your state statute if available. I know that some teams operate without statute. You wanted to outline that reviews does not determine criminal or civil liability. And you could also bring in a legal expert early to reassure agencies with their involvement as well. So you want to seek small funding for coordination if possible. Sometimes there is usually state funding available for prevention efforts. So look at what your state have available. Sometimes small grants will be sufficient enough to start this domestic violence fatality review team. And then you want to plan logistics realistically based on your community. So you might want to consider quarterly meetings instead of meeting monthly. You want to use virtual meeting options if distance is a barrier for some of your members, and provide food if it's in person. I can tell you that this matters, especially in long rural days, but it's also a great incentive to increase engagement. So when I assisted communities with building coordinated community response team, having food during those meetings increase attendance by far, especially with the law enforcement. It was always a good buy-in. And then you possibly want to keep your reviews 2 to 3 hours max if that's sufficient for your community. And then lastly, turning those findings into small, achievable changes. So big system reform may take time. So you might want to start with improving lethality assessment use, creating a referral cheat sheet across counties that's available to your agencies. You also could do cross training with law enforcement and advocates. Maybe just clarifying a firearm surrender protocol is sufficient, or developing a high risk response team protocol is usually a good starting process before developing a DVFRT as well. So you just want to focus on the learning process and not perfection. And remember to celebrate small improvements and not just identifying gaps. So case selection also matters because it shapes what we learn during the review. So we always suggest that DVFRTs address disparities in domestic violence fatalities. So all races are impacted by domestic violence homicide, but DVFRTs should identify who is dying at higher rates and who is at greater risk of being killed when experiencing domestic violence in your jurisdiction. So when considering the population of your community, do domestic violence fatalities reflect your community demographics? So, for example, if Black residents account for only 15% of the population, but your fatality data shows that 60% of victims are Black, you can see that survivors in the Black community are at elevated risk and are most likely experiencing barriers to safety. So we should be examining the frequency of the homicides for a particular race and who is at greater risk of becoming a homicide victim as well. So your team should also collect data on race and ethnicity on DV victims to identify homicide to better understand the impact of cultural factors on the case as well. So analyzing this data can inform targeted interventions and prevention strategies. So one thing I did notice throughout the course of this project, we do look at team reports from several teams across the nation. And while most teams actually address race and who died at higher rates in their reports, surprisingly, there were several organizations and DVFRTs who did not. So, how are we going to know who's dying at higher rates? How are we going to know what prevention methods are needed or what barriers are they experiencing? So, it's very important to address those disparities in the homicides within your community. You also want to avoid cherry picking cases and review all cases that are allowable within your team policies and your legal framework. So usually we recommend to prevent cherry picking cases or reviewing only the high profile or well-known cases. It is recommended that teams select a specific time frame or types of cases that are appropriate, and your team then conduct a comprehensive review of all eligible cases within those standards. So for example, some teams actually review cases that are fully adjudicated, that are completed. They're not going to review cases that are still open. So if you have all these closed cases, then if possible, review all those cases within that time frame. You want to collect information from agencies, but remember, agency records only tell us how systems responded and not the full survivor story. So, what is missing from records is often just as important as what's documented as well. So, when you're reviewing cases, you want to develop a chronological list of events. Chronologically help us move from isolated incidents to patterns over time. You want to look across systems. You want to look at life events and then key turning points as well. There is usually missed prevention opportunities. Usually they become visible when you actually develop a chronological event list of events. You want to review these cases for systems and barriers. So this is the heart of fatality review work, as I stated before. You want to examine how systems functions together and what barriers existed. Again, the focus remains on the system responses and not the survivor's choices as well. So reviewing case facts in the context of culture, teams should take time to understand the survivor's culture background and specific challenges they face in domestic violence prior to their death. With this knowledge, teams could usually better meet the needs of other victims of color and ensure their safety. So, interviewing family and friends and any cultural navigators or key informant in cases is very important. So, family, friends, and coworkers and other community members play a significant role in supporting victims of color. The key informants are critical to reviewing domestic violence homicide because they could provide your team with background information that will help you better understand the lived experiences and culture of the parties. Again, as I stated before, usually survivors of color do not trust systems and they often rely on family, friends, and faith leaders. So it's important that we're interviewing family and friends because it adds that critical context that can't be found in system records. These conversations must be trauma informed and voluntary, and lived experiences help us understand escalation and coercive control as well. And then you want to discuss culturally relevant findings and how these findings can be used to reduce future domestic violence homicides. So teams should examine cases for cultural factors that may have influenced the victim's experience of abuse. And it's important to consider culturally specific barriers that might have prevented a victim from receiving necessary services that would keep them safe. Such barriers can be cultural customs, traditions, and practice. Again, all of the barriers that we discussed on the previous slide. And then when it comes to making recommendations, so good recommendations are going to be realistic for your community. They should improve the safety and accountability without increasing the survivor's burden. And good recommendations should also reflect the community's actual capacity. So, making recommendations that address culturally diverse needs of at risk community members can include developing support services that are culturally sensitive and relevant to diverse backgrounds of at risk community members. And this may include like language specific services, culturally relevant counseling as an option, and community led initiatives as well. So these recommendations should address systemic issues that may have contributed to the victim's death. And then you want to partner with diverse community support and advocacy organizations to implement recommendations as well. So teams should engage with culturally specific organizations, community leaders, and advocates who work with survivors of color. So building relationships with these stakeholders can provide you with valuable insights into cultural issues and effective intervention for effectively addressing domestic violence in those diverse communities. And lastly, we want to develop culturally relevant action plans to accompany those recommendations as well. So, after conducting a review, teams should deliberately create action plans to address identified barriers and needs in that review. These action plans should address the needs and barriers to safety for victims in marginalized communities. So, fatality review without action does not prevent future deaths, unfortunately. Remember, the purpose of fatality review is prevention and not just for documentation. So, every case should result in concrete, measurable recommendations. If nothing changes in policy, practice, or coordination, we risk repeating the same systemic failures, unfortunately. So, implementing change can include things such as updating agency policies, improving lethality assessment and firearm enforcement, strengthening cross system communication, expanding culturally specific partnerships, enhancing training for frontline responders. And teams should also build a process to track what was recommended, what was implemented, and what was improved. So most teams also usually share an annual summary and a yearly report that I talked about earlier. So these reports are usually or should be made available to the public and should be shared with individuals such as mayors, parish or county executives, city council, community commissioners, state legislators, and your government office. So they are aware of the findings, and this could also help when you're applying for funding for any prevention efforts. So having this information in this report and providing these reports to positions of power could be very beneficial for your team in the startup process and, of course, to sustain your team as well. I was checking to see if we have any questions. So I do have a quick video that I do want to share with you all, but I do want to provide a trigger warning. Some of you may be sensitive to some of the information that is displayed in this video, but I think it's going to lead us into to a great segue into the next portion of our training as well.
My dream was just to have the perfect kids and the perfect husband, the perfect life. The first time he ever hit me was because the macaroni and cheese didn't taste right. You know, people was like, why did you just leave? Well, it's not as easy as you think it is to just leave. He made a lot of threats. He made a lot of threats to hurt the things that was most precious to me was my kids. And so I stayed.
In Illinois, we have close to 13 million people. It's estimated at least 300,000 of those people are domestic violence victims.
We could have 2 to 3 calls a night on domestic of some type. I mean, it happens quite often around here.
Look at the rural parts of the country, and I don't care what state you're in. To get anywhere to do anything, you have to drive a long ways. So first of all, you have to have a car that runs. You have to have a phone that works. Our child welfare systems aren't there. There's no hospital down there. You can't get access to resources.
A lot of times when women get married around here, they don't get jobs. They stay home and take care of the kids because if they do go to school, there's really no job. This has always been kind of like a coal mining industry in Southern Illinois. That's about all there is, the prison system and coal mining.
When I was little, I wanted to go in the coal mines, but family and friends told me I couldn't do it because I was a woman. So it's like they don't even give us a chance.
It's all you can do to make ends meet. Even if you both have full-time jobs, it's rough. It's just rough. And 9 out of 10 women stay for the same reason I did. How was I going to make it with 4 kids by myself?
I have stayed in a relationship because of money, and I have been through abuse because of it. I needed money for my kids because I didn't know what else to do.
Someone has chosen that they want to be in control of the person they're in partnership with. They have a bunch of tools that they use, whether it's physical, financial, emotional.
He is a terrorist. He has one victim that he terrorizes, not all of America, but this one person. And a lot of people don't see that, don't realize that, but she's terrorized each and every day.
My son is telling me how he was abused by my ex-husband when I was gone. He would beat him and tell him if he told, he would beat me. So basically, my son took beatings to protect me. And that's really hard as a mom to understand when your baby takes beatings for you.
And everybody, well, why don't you just leave him? Why don't you just leave him? He would say, well, I'm going to kill you. I'm going to kill me if you leave. Look, guys, you do not understand how hard it is to leave an abusive relationship.
When he was abusing me all those years, every time that I would call the police, they would just tell him to calm down, everything would be okay. They'd ask him to leave and drive around the block.
We would sometimes believe a lot of what the man said and not so much the women, because we had the attitude that she must like it because she's staying with him.
It's been 25 years. Glenn came home that night from work. He abused me for 7 hours and 45 minutes. I thought he had fell asleep, so I thought it was going to be over with. So I got up and I was starting to tiptoe. I was going to go in there in the kid's bedroom. And when I did, he had laid the gun down on the floor beside the couch. And I seen him move and go to grab for it. And I don't even remember. Somehow I dove for it. And somehow I got it before he did. I don't know. And just turned my head and fired. I didn't know if I'd hit the couch, if I'd hit him, where I'd hit him. And stood up and turned around. I looked and I seen that I had hit him. And then I heard him die. Me and Glenn were together for 12 years. Only man that I've ever actually loved. I never wanted it to get to this point, but I don't feel like I had a choice.
I was probably the first that got the training that was needed for us to understand, I guess, more or less the female side of this. When they're a male abuser, they've seen their father do it, they've seen their grandpa do it. They think it's normal. You got to break that cycle.
You know, I've made it this far. Now it's my turn to love my children and grandchildren unconditionally. You can just save one other person, it's worth it.
Once we all connect the dots and everyone stands up together and says, we're going to teach our children different ways, then we'll begin to make a difference.
I made it.
You did.
Okay.
Woo.
So I do want to open up discussion. So what challenges in this video stood out to you most and why? And also, what barriers felt most familiar to you in your community? Financial, uneducated law enforcement, yes. So what challenges in the video stood out to you most and why? And are any of these barriers similar in your community as well? Believe in the man. Yep, economic drivers, a survivor being stuck. Absolutely. Sexism, big one. Believe in the men. Transportation, isolation, afraid to report. Yes. In my community, uneducated law enforcement, sexism, money transportation. Yes. Okay. I know that was a very heavy video, but I think it also was great to show a survivor's experience in rural communities as well. Yes, the officer's honest discussion about understanding DV. Yes, I know I love that. I'm happy he was very transparent about it and it seemed he got the education that was needed. Awesome. Okay. So here are some challenges that are usually faced when responding to domestic violence in rural communities. So, of course, as some of you have already stated, there's the confidentiality concerns. Everyone knows everyone communities, right? So there's usually some personal relationships with victims or even the offender, fear of gossip, or even fear of professional backlash. And then also in rural communities, agencies are usually smaller, which usually makes it easier to identify cases. And then there's the strong cultural norms that may emphasize privacy, as I talked about. You know, matters to keep family matters private. So survivors are usually told to keep it private and not reach out to systems. So that is very true for rural areas as well. And then you have limited staff time and competing priorities, which is a reality for most nonprofits, right? But some examples in rural areas when responding to domestic violence, it may include like one prosecutor handling everything. So there's not a dedicated domestic violence prosecutor. And then there's the sheriff's office that is probably stretched thin. And then you have advocates possibly covering multiple counties or jurisdictions. So these are often real realities when dealing with responding to domestic violence in rural areas. And then there's the fear of blame and liability. So there may be fear of blame amongst organizations in the DVFRT process. So professionals usually feel personally connected and they have a misunderstanding of what the purpose of a fatality review is, as we talked about early in the training as well. And then you have record and data gaps. So sometimes there are multiple counties involved, and it gets real tricky when we're talking about tribal and military jurisdictions as well. And then sometimes there's limited domestic violence specific expertise. So you may have few specialists available, little access to training, and maybe no lethality assessment use or strangulation protocols may not be available as well. And as some of you also pointed out, and the video did as well, geographic and transportation barriers, right? So long travel distances, no public transportation. If you don't have a car, how are you supposed to get assistance and get, again, as the video stated, no local hospital, which is a big one. And then there's the emotional impact that serves as a barrier in rural communities as well, because it's so close knit. So members may know the victim and their family, or members may have known the victim or perpetrator family. So reviews can sometimes feel very personal and heavy. And then we talked about increased risk of firearms prevalence in rural communities, as we talked about the states with the high gun ownership. Um, and notably, again, southern states and southwest states were usually found in the top 10 homicides within the last 25 years. And then sometimes in rural communities as well, there's usually an over reliance on survivors to manage their own safety. As the law enforcement officer said, we just told him to leave because we assumed that she must like it, right? Just putting it in the survivor's hand to figure out her own safety. So here are some possible solutions and action steps that you can take when facing some of these challenges. So when it comes to confidentiality concerns, you want to establish strong confidentiality agreements early. You want to review and explain state fatality review protections at every new member orientation. You can de-identify case materials whenever possible as well, so that the case is not easy to identify. And set ground rules. So you could say things such as no case details leave this room ever. Of course, it does not guarantee, but again, just ensuring the team that this is all confidential matters and nothing should be taken outside of this room. And then when you have limited staff time and competing priorities, some of the action steps you could take is meet quarterly instead of monthly. You want to keep the meetings tightly structured, have an agenda and have a timekeeper, rotate presentation responsibilities, and share pre-meeting summaries so that people have more time to prepare. And then we also talked about earlier, of course, traditionally these teams usually meet in person, but if it's beneficial for your community, especially in a rural community, it's okay to conduct these meetings virtually as well. And then you have the fear of blame and liability from some partners, right? So some action items, you want to open every meeting with a purpose statement. So we review systems and not individuals. So reminding them this is not an individual situation. We're reviewing systems to better respond in the future. So you want to use neutral system focus language, such as instead of blame, again, focusing on the system. So instead of saying law enforcement failed to protect the victim, we could say there were missed opportunities within the law enforcement response process. So instead of saying the court didn't take this seriously, we could say the court response may have not been fully reflected in the level of documented risk. So you want to avoid why didn't they and use what policies or conditions actually shape this response, right? And then when it comes to records and data gaps, you want to build relationships with your local clerks, record staff, and dispatch to make it easier to obtain the documents that is needed. You want to create a case timeline that organizes all the scattered information and use known versus unknown categories rather than forcing assumptions about a case as well. So if you have limited domestic violence specific expertise in your community, here are some other examples that you could implement. So besides requiring ongoing training that I talked about earlier in the training, you could also build many learning moments into these meetings. So an example is implementing a 10-minute DV topic each review. So one example could be like a myth or fact, a quick trivia, a DB fact trivia icebreaker would be sufficient. You could read a statement and have members vote by raising their hands, using color cards, or chatting if it's virtual. You could also invite regional experts virtually to provide training. Your team should also share tools that you are familiar with other team members, such as tip sheets or any tools on lethality indicators, coercive control, or firearm risk factors could also be helpful during this time. And then we also talked about rural areas and geographic challenges, right? So again, offer hybrid or virtual attendance options. Maybe rotating meeting locations could be helpful as well, so that it's fair for everyone. And schedule meeting times that avoid court or shift changes as well. So when we're examining domestic violence, that's with an understanding of cultural context, it offers many benefits to your team. So it addresses the needs of diverse groups of people. Understanding the culture helps the team put the information you're reviewing into context. It enhances the quality of the case reviews and action plans within diverse and underserved communities as well. So, usually, recommendations regarding culturally specific findings can reduce future deaths of these populations, as I stated throughout this training as well. So it can improve victims' access to and utilization of services, which enables support when survivors trust systems more. And then it promotes culturally responsiveness as an essential approach in the elimination of all domestic violence disparities and the promotion of equity, which is important during this work as well. So, as I spoke about earlier in the beginning of this training, as a part of this project, we do offer office hours every third Thursday of the month. And during these sessions, teams are usually able to jump on Zoom, ask any questions related to domestic violence fatality review, or also increasing culturally responsiveness, or just dropping by to chat. So, if you scan this QR code, it'll actually take you to register for our next coming office hours. And then you could also contact me as well, and I'll provide my contact information here in just a second. So here is my name, of course, contact information. This is where you can reach me if you have any questions about anything that we talked about today. As I stated before, I know that starting a DVFRT is a entire training alone, and I try to cover some of those things, of course, to just give you a brief introduction to it. But again, if I could assist you in any way, here's my contact information, and let me know how I could help.
Thank you so much. There's a question in the chat. It says, do any states allow a survivor to file a complaint in a different county if that survivor is, if it's more likely for them to seek help? Or is it, are the jurisdictions strictly enforced?
Right. So in my experience, jurisdictions is strictly enforced, right? So for instance, for a protective order, you could file in a certain jurisdiction, either you or the party lived in that jurisdiction, the abuse happened there, or if the survivor previously lived in that jurisdiction. And if we have any attorneys on the call, feel free to chime in on jurisdictional issues as well. But from my experience, it is tied to that jurisdiction of where the survivor live, where the abuse happened, and where the marital home exists as well.
Okay. And then another question in the Q&A was how would you recommend responding to people who advise victims to get a gun for self-protection against domestic violence? I get frustrated because it feels like those folks don't understand how complex that response is and how the victim might feel. And if they're often criminalized if they do defend themselves.
Absolutely, absolutely. So we're on the same page when it comes to firearms and suggesting that victims arm themselves. So during my years of direct advocacy and working with survivors, I was asked that question a lot. And of course, if a survivor did choose to arm herself, we did some safety planning with it, of course. But the issue with telling survivors to arm themselves is that in the heat of the moment and trauma, most of the time, the victim's weapon is used against them by their perpetrator. Because of the trauma response, they're usually not able to protect themselves. And then there's that fear dynamic, right? So they're not always able to react because there's a love. They, even though their perpetrators sometimes do harmful things, love was there at some point. So it's not always helpful. But again, we can't decide for a survivor, but if you have a survivor who wants to arm themselves, there should absolutely be a conversation, about some of those things and safety planning. Because most of the time it just does not work in their favor, unfortunately. And as you stated, we see the rise of survivors who are being criminalized for protecting themselves. For instance, the lady in the video. She knew, even though there wasn't a physical incident happening at that time, she knew if he woke up that he was going to hurt her first. So she actually fired. But again, she did not get away with it. She did spend time in prison, unfortunately. And we see that happen so often among survivors of domestic violence, unfortunately.
Thank you. There's another question that says, have you had to intersect with state address confidentiality programs and violations?
Could you repeat that question?
Have you had to intersect with state address confidentiality programs and violations?
Not with violations. No, I did assist survivors with address confidentiality programs, but again, I never really had like a violation issue. I'm not sure if I'm understanding that question correctly.
I don't really see, I guess she says local
Oh, put
complaints.
the barcode again. Let me see if I can
Yes.
go back. Let me see. They have this icon here. I'm trying to go back to my slide. Let me see if I can do that. Oh, I need to move this. I'm sorry, there's like an icon that I can't. Oh, okay. Like right on the toolbar where I needed to click. So, yes, so this is the QR code for office hours. So you could scan and it'll take you to registration for our next upcoming office hours event. Anyone else?
And LeTesha, that question was clarified. It says,
Okay.
have the address confidentiality programs been effective then in your experience?
Yes, yes. So it has been effective. So of course there were survivors, high lethality, of course, and it was fairly easy to obtain, and it was effective to keep that survivor's confidentiality with her address. So yes, I enjoyed it. I thought it was very helpful with the survivors I worked with directly. So I do think it's an effective intervention. So I do recommend it.
Okay. All right. Well, I'm
And
gonna
I'm sorry, I went through this information so fast. I don't know why I was so nervous. I've been
No,
doing this for a long time, but I hope that the information was digestible and I didn't move too fast. And again, I could share these slides with everyone so that you have something to refer back to as well.
Yeah. And I'm gonna share my screen now.
Okay.
Okay, so just want to say thank you so much, LeTesha. This was an amazing webinar with some compelling and pertinent information, and I hope everyone was able to take away something because there was just so much that was given, throughout this training. I wanted to let everyone know about the National Training Center, which is also a program on the Conference on Crimes Against Women. We have a virtual training called Departing from the Ordinary, an overview of CSIRT model to reduce secondary trauma and burnout. It's March 10th from 1:30 to 3, and it's completely free and it's virtual. It's going to be via Zoom. And then next, if you haven't already registered, please register for the Conference on Crimes Against Women, the annual conference. Early bird pricing does end March 1st. So please go online and register today. That's my contact information. I'm Demaya Pridgeon, the program manager, and my director is Lacey Hensley. So thank you all so much for joining us today, and we truly appreciate you being here. And thank you, LeTesha, for your partnership on this. We hope
Yes,
you all
of
have a
course.
wonderful day.
Thank you, everyone.